When you look around the world, does it ever occur to you when you look at the number of people who are struggling with mental health challenges and a whole range of other challenges that we might be missing something? We might possibly be missing something really big. Now, you've heard about the elephant. Yeah, sometimes the elephant is so big that we actually can't see it. Yeah. So that was the point that I started off with this project. Had done years of training, first of all as a teacher, and then I became a clinical psychologist. I was also a new parent at the time. And though I was learning all sorts of really super interesting ideas, I always had the feeling that I couldn't quite piece the ideas together because it felt like there was something slippery, something that I couldn't grasp. But I didn't know what it was. I didn't understand what I was missing. But what I did know is that when I tried to put the things learned into practice in my professional roles and in my parenting roles, somehow it wasn't all holding together. And so what I did is I decided to go back to the research to try and understand what it was actually telling us. And I experienced myself as doing a very large jigsaw puzzle. The research was incredibly interesting. But the good news was it did finally come together. The pieces started to fit together. But I realized, just like when you're trying to do a jigsaw puzzle, sometimes you have a jigsaw puzzle, but you don't have the picture on the box. You realize that you've actually been putting the pieces together, but the picture actually needs turning around. You've got some kind of key ideas in the wrong place. So slowly this picture emerged, and I started to realize that what it was telling us was that the adult role was incredibly important in the well-being of children, as well as the well-being later of adults. And that wasn't really the way I'd been trained because a lot of my focus was on, working on what we call child-focused practice, child-centered practice. But actually what the research was telling us was that the adult role was incredibly important. Fast forward a few years, I started to put some ideas together, and then one day I decided to do a quick search for what was written on the topic of relationship health. Now, I just thought I'll just have a quick look. And I was absolutely amazed to discover that there was nothing written, no books on the term relationship health. There was an awful lot written about healthy relationships, but relationship health was not something that I had been introduced to me in any of my clinical training. It was a term that wasn't being used. There were no books in the entire online Google catalogue. And so there was this huge light bulb moment, and I realized this was the idea that I was looking for, which helped me put together all these fascinating ideas that I'd been learning into something that felt like it finally had some solid foundations. So we know that there's been lots of focus in our health thinking, in our health prevention around the issue of physical health and what we can do to take care of our physical health. The issue of mental health was seen as very sidelined, but eventually people worked really hard and the issue of mental health started to be given some sort of equal status with physical health, and services were developed for mental health. But I think relationship health is like that. It's an issue and an idea that we know something about it, but we haven't put the spotlight on it. And it's important to put the spotlight on it because what the research is telling us is that when we look after our relationship health, then our mental health can improve, our physical health can improve. Indeed, when we have mental health challenges, this can impact on our relationship health, but our relationship health can give us resiliency to support our mental health and support our bouncing back. So now I talk about the triangle of health. And what I like to do is to convince people that the research is telling us that it's incredibly important. And in order to explain what that research is telling us, I put something together called the IMATA framework. And the amateur framework basically takes the research ideas and takes key concepts that have been tried and tested in lots of literature, but also have been tried and tested in my own practice as a practitioner in clinical psychology with children and family services and working with adult mental health services, as well as in the classroom. And these ideas that I know are really important when we're trying to make sense of confusing and complex situations in relationships. And I know that when you have an understanding of these core ideas, then, as I say, the dots start joining up and it starts to be easier to figure out what to do in challenging situations. It makes it easier to understand what people are talking about in different research traditions. And it makes life more interesting and more manageable. So, if you'd like to learn more about relationship health, you'd like to learn more about the amateur framework, I'd love to hear from you and love to hear your questions.